Hey everyone, and welcome back to the channel. Today, we're tackling a topic that affects so many of us. Nagging, persistent back pain. If you've ever found yourself wincing just from bending over or struggling to get comfortable at night, you know exactly what I'm talking about. The good news is you don't always have to rush out for an expensive appointment. There are so many effective things you can do right in the comfort of your own home to find relief and get back to living your life. In this video, I'm going to walk you through a complete guide to at-home back pain treatment, from immediate relief techniques to long-term prevention strategies. So, if you're ready to say goodbye to that ache, stick around. First things first, when that pain strikes, what's the initial game plan? Let's talk about the classic duo, ice and heat. It sounds simple, but using them correctly is key. For the first 24 to 48 hours after an injury or a flare-up, ice is your best friend. Applying an ice pack wrapped in a towel to the sore area for about 20 minutes at a time can work wonders. Because the cold constricts blood vessels, which helps reduce inflammation, swelling, and it even numbs the area, giving you some immediate pain relief. Think of it as a natural anti-inflammatory. Don't apply ice directly to your skin, though always use a barrier like a cloth or towel to prevent ice burn. After that initial 48-hour window, it's time to switch to heat. A heating pad, a warm compress, or even a nice warm bath can be incredibly soothing. Heat does the opposite of ice. It increases blood flow to the area. This increased circulation brings more oxygen and nutrients to the damaged tissues, which helps your muscles relax and promotes healing. Heat is fantastic for stiffness and chronic muscle soreness. Alternating between ice and heat can also be very effective for some people. Listen to your body. It will often tell you what feels best. Remember, 20 minutes on, at least 20 minutes off. Now, let's talk about movement. I know when your back hurts, the last thing you want to do is move. Your instinct is to lie down and stay completely still. While short-term rest may be for a day or two, okay for severe pain, prolonged bed rest can actually make things worse. Your muscles can become weaker and stiffer, leading to a vicious cycle of more pain and less mobility. The key is gentle movement. Simple activities like walking can be incredibly beneficial. It gets your blood flowing without putting too much strain on your back. Even a short 10-minute walk around your house or your neighborhood can make a significant difference in how you feel, both physically and mentally. Beyond walking, gentle stretching is your next powerful tool. Tight muscles, especially in your hamstrings, hips, and lower back, are a major contributor to back pain. We're going to go through a few simple, safe stretches you can do right on your floor. First up is the knee to chest stretch. Lie on your back, with your knees bent and feet flat on the floor. Gently pull one knee up towards your chest, holding it with your hands for about 20 to 30 seconds. You should feel a nice, gentle stretch in your lower back and glutes. Then, switch to the other leg. Do this a few times on each side. Remember, these should be gentle pulls. Never force it or stretch to the point of sharp pain. Another fantastic stretch is the cat-cow. Get on your hands and knees with your wrists directly under your shoulders and your knees under your hips. As you inhale, drop your belly towards the floor and look up, creating an arch in your back. This is the cow pose. As you exhale, round your spine up towards the ceiling, tucking your chin to your chest like a cat stretching. This movement gently mobilizes your spine, improving flexibility and relieving tension. Flow between cat and cow for about a minute, coordinating the movement with your breath. It's incredibly therapeutic. Finally, for the lower back, a gentle spinal twist can feel amazing. Lying on your back, bring your knees toward your chest and then slowly lower them to one side, keeping your shoulders on the floor. You can extend your opposite arm out to the side and turn your head to look at it for a deeper stretch. Hold for 30 seconds, breathe into it, and then gently bring your knees back to the center and switch sides. This helps to stretch the small muscles along your spine and improve rotational mobility. These stretches are your daily maintenance program. Doing them in the morning can help with stiffness, and doing them before bed can help you sleep more comfortably. Now, we've covered immediate relief, but how do we stop the pain from coming back? It's all about building a stronger, more resilient core and back. Your core isn't just your six-pack abs, it's the entire group of muscles in your midsection, front, back, and sides that act as a natural corset for your spine. When these muscles are strong, they take the pressure off your spinal column. One of the best and safest exercises to start with is the bird dog. On your hands and knees, engage your core by pulling your belly button in towards your spine. Then slowly extend your right arm straight forward and your left leg straight back, keeping your back flat and your hips level. Hold for a few seconds, then return to the start and switch sides. It's harder than it looks and is excellent for stability. Another foundational core exercise is the bridge. Lie on your back with your knees bent, feet flat on the floor, hip width apart, and your arms by your sides. Squeeze your glutes and lift your hips off the floor until your body forms a straight line from your shoulders to your knees. Hold for a moment at the top, making sure you're not arching your back, and then slowly lower back down. This strengthens your glutes and hamstrings, which are crucial support muscles for your lower back. Aim for about 10 to 15 repetitions. Building this strength is a long-term project, but it's the most important investment you can make in preventing future back pain. Of course, prevention isn't just about exercise. It's about how you move through your day. Let's talk about posture. Whether you're sitting at a desk, standing in line, or even looking at your phone, your posture matters. When you slouch, you put enormous strain on your back muscles and spinal ligaments. Try to be mindful of your posture. When sitting, make sure your feet are flat on the floor, your back is supported, and your shoulders are relaxed and back, not hunched forward. Your screen should be at eye level, so you're not craning your neck down. Set a timer to remind yourself to get up, stretch, and walk around every 30 minutes. Little adjustments make a huge difference. And what about lifting? Improper lifting is one of the most common causes of acute back injuries. The golden rule is lift with your legs, not your back. Before you pick something up, get close to the object, plant your feet firmly, bend at your knees and hips, and keep your back straight. Engage your core, and as you lift, straighten your legs, using their power to bring the object up. Never twist your body while lifting. If something is too heavy, please ask for help. It's just not worth the risk of weeks or even months of pain. Finally, I want to touch on the importance of your overall well-being. Stress, poor sleep, and a poor diet can all contribute to inflammation and muscle tension, making your back pain worse. Finding healthy ways to manage stress, whether it's through meditation, hobbies, or spending time in nature, can have a direct positive impact on your pain levels. Prioritizing good sleep is also crucial because that's when your body does most of its healing and repair, and maintaining a healthy weight reduces the overall load on your spine. It's all connected. Now, a very important disclaimer. While these at-home strategies are fantastic for most common types of back pain, they are not a substitute for professional medical advice. If your pain is severe, the result of a serious injury, or if you have symptoms like numbness, weakness in your legs, or problems with bladder or bowel control, you need to see a doctor immediately. Those can be signs of a more serious condition. So, to recap, use ice first, then heat. Stay active with gentle movement and walking. Incorporate daily stretches like knee to chest and cat-cow. Build long-term strength with core exercises like the bird dog and bridge. And always be mindful of your posture and lifting techniques. It's a holistic approach, but taking these steps can empower you to manage your back pain effectively from home. Thank you so much for watching today. I hope you found these tips helpful and that they bring you some much-needed relief. If you enjoyed this video and want to see more content like this, please give it a thumbs up. And do not forget to subscribe to the channel and hit that notification bell so you never miss an update. Stay healthy, stay strong, and I'll see you in the next video.